Hello and welcome, everyone. I'm Erin Ryan from the Massachusetts Health Connector. I'm joined today by my colleagues, Nikki Conti and Melissa Montrond, who will be presenting today's information. And Kayla Sherry will be joining us for our question and answer segment. Together, we are here today to share information about getting insurance coverage through the Health Connector and to help answer any questions you might have. We would like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and your video has been turned off. The presentation portion will last approximately 30 minutes, and then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We'll be monitoring your questions throughout and we'll answer those at the end of the presentation. Please do not share any personal information or private health information when you ask your questions, as others on the call may be able to see what you've written. If you have a personal scenario that you would like to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local navigator. We are recording today's webinar. Following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. And so without any further ado, I will hand it over to my colleague, Nikki Conti, who will start us off today.
Thanks so much, Erin, and thank you everyone for joining us today. So we're really grateful to be able to give you this information from the Health Connector, particularly as we are outside of open enrollment now, but we do know that there are still people who need health insurance coverage. So with that, I will take us to the agenda. There are 4 things that I'll be covering, and then I will hand the presentation over to my colleague, Melissa Montrond, who's going to do a couple of demonstrations with all of you that we hope you'll find very helpful. So I will step through an overview of the Health Connector for those of you who are less familiar. I'll talk a little bit more about getting individual and family coverage, talk to you about getting help. So specifically where you can, where and how you can contact our customer service, or if you'd like some more personalized support, where you can get assistance from a local navigator or even a certified application counselor. And then, of course, we will do a quick recap because there is going to be a lot of information that I'll be bringing to you this afternoon. But again, we will have time for questions and answers with Melissa and Kayla Sherry from our team. So let's get started. For those of you who don't know who the Health Connector is, we are the state's health insurance marketplace, and we are here to offer individuals, families, and small employers with access to affordable health insurance coverage. So you might be wondering, who are the people that are getting coverage through the Health Connector? And it's really those who don't get health insurance through their jobs or another source. Some people, or actually I should say many of the people who apply do get help paying for their premiums. And I'll talk more about that as we go through the slides. Now, you'll hear us talk a lot about health insurance, but I also want to mention, very important to mention, that someone can purchase dental coverage through the Health Connector. And not covered today, but important for everyone to know that in addition to offering individual and family coverage, we are here to offer plans to small employers, those with 50 or fewer employees, and they can offer health and dental plans through our Health Connector for Business program. So I will go through these items in a really high level way because I'm going to touch upon all of them in greater detail in further slides. So let's talk a little bit about Health Connector plans. The big takeaway I'd like you to get from this slide and even this presentation is that, as a consumer, you can rest assured that all of the plans sold through the Health Connector meet all of our state and federal standards for coverage. So what does that mean? That means they're comprehensive health plans. They meet our state's requirements for the individual mandate, and you don't have to worry. It's any plan that's sold through the Health Connector. So just to give you a little bit of insurance speak, all of the plans are known as qualified health plans and qualified dental plans. But what you need to know as a consumer is that each plan, we have a variety of health insurance carriers who participate in our platform. In fact, the majority participate on our platform. And depending on where you live in Massachusetts, you can choose from those participating carriers in your area. So we'll talk more about that, and Melissa will show you when she's looking at, when she's showing you the tools, how you can see what is available near you. Now, I've already talked about savings and how a lot of people do qualify for savings, but that comes through tax credits, and those tax credits reduce the cost of somebody's monthly premium. So that is something that we'll touch upon quite a bit as I'm going through the slides. But I also wanted to mention our connector care plans, because that is unique to Massachusetts. And so for those folks who are in lower income ranges, who meet other eligibility requirements, they could qualify for these low or no cost insurance coverage options. And again, these are great plans, low monthly premiums and no deductibles. The Health Connector also offers catastrophic plans available to people who are under 30 years of age or with a waiver. And then, of course, dental plans. And I also already mentioned Health Connector for business plans. So let's get into it. Who can apply? So when you're thinking about applying for coverage through us, essentially it's important to understand that this coverage is for Massachusetts residents. Folks need to be a US citizen, US national, or otherwise lawfully present in the United States. And again, this is for people who don't have access to health insurance. So if somebody is already enrolled in Medicare, if they're enrolled in our state's Medicaid program called Mass Health, or any other type of public health coverage, like certain veterans benefits, so these folks should not apply. We're really trying to get people to get their coverage from the source that is available to them first. So for example, if you're offered affordable comprehensive coverage from an employer, either yours, your spouse, or partners, that's where that person should be getting coverage. You should be looking for coverage there. Now, when can you enroll? I briefly mentioned a term called open enrollment at the beginning. And you can see that basically, the thing I want you to know about is, the Health Connector offers an open enrollment period. This is something we have every year, and it typically runs from November 1st through January 23rd. Now, today's presentation is being held in February, so we're in what's known technically as a closed enrollment period. And we'll be in that state from now through October 31st. But that does not mean that if someone needs health insurance coverage that they need to wait until open enrollment starts again. If someone has a qualifying life event, they can enroll in or change health insurance plan during this time frame. So they can be outside of our annual open enrollment period. So life events that let somebody qualify includes things like changes in their household size, changes in income, whether that's going up or down. Maybe someone's immigration status has changed or they've moved. People move into Massachusetts all the time, or people move within Massachusetts. So depending on where someone lives, they're going to, they may no longer have access to a particular carrier and need to reshop for a different health insurance plan. As you can also see on the slide, there are things like if someone's getting married, having a child, adopting a child, or if somebody is losing their health insurance coverage from a job. All of these types of things are qualifying life events. So if you are thinking about your own situation and wondering, okay, this is about to happen or this has happened, does this kind of fit one of these categories? we have a detailed list on our website, and you can see that comprehensive list. Now, what's really important is that if you do have a qualifying event, it should be reported within 30 days of it happening. And then you have 60 days from that date to select a new plan. So if you're applying and enrolling for the very first time, keep in mind that all payment and enrollment deadlines still apply during your special enrollment period, but essentially it's your window into coverage, so you don't have to wait until next year's open enrollment period. All right, so what should you know about applying? First is there are 3 ways to apply. The fastest way to apply is online at mahealthconnector.org. We also have a Spanish version of our website, same address, mahealthconnector.org, but with the /ES. This is the fastest way. Can't stress enough, you can sit down, enter all your information, and at the end of your session, you will have a result. So you'll know, what it is you qualify for. You can begin your shopping process. I also want to acknowledge that you can do this over the phone, and you can do this with the help of a community partner organization, a health center, even hospitals have what are known as certified application counselors, and I'll explain that in a little bit. But really important is that if you go to mahealthconnector.org and you need health insurance coverage, there is one application in Massachusetts to find out if you qualify for coverage, either through the Health Connector, and that includes like getting help paying for that coverage, or if you qualify for Mass Health, our state's Medicaid program. And I raise that at this point so that you understand that when somebody applies, they get letters from both the Health Connector and Mass Health. And those letters will tell you your next steps. But sometimes people say, well, wait, I applied at the Health Connector. Why am I getting this information from Mass Health? So just want to acknowledge that we share a system. Now, what do you need to apply? You should have social security numbers for everybody who's applying, if they have one. If someone has immigration documents, you want to gather all of those for anyone who's a non-citizen who's applying, if they've got it handy. And if you are trying to figure out, like, I've got this document, I've got that, I'm not sure exactly what this document's called, we've got a detailed list on our website. You can follow this link when you get the slides, and you'll see samples of all of our variety of immigration documents and what they're called, etc. Now, if you are applying for help with your coverage, we're going to need to gather some income information from you. So we do that by asking for copies of your last 2 pay stubs. If someone is collecting unemployment, we want to have the monetary determination. That's basically the letter that you are getting from the Unemployment Assistance Office. And any other information about your current income. And again, I really want to offer here that if you don't have all of this information in front of you, but you do need health insurance, please don't stop. Please don't stop or decide that you're not ready to start this process of applying. Because if you can enter all of the information you have, we'll get a letter out to you explaining if we need more information from you. And you'll also see that on the screen. So what does it look like when you apply? When you go to mahealthconnector.org, there'll be an area where you can apply for individual and family coverage. And then you're brought to this site. This is our application. And as you can see, you'll see something similar visual if you go to the Spanish website. And again, this is one application for both Health Connector and Mass Health coverage. And if you have ever applied before, really encourage you to use that application and just update it. So we would want you to go to sign in. If you forgot what your username and password is, it's just, follow the instructions on the page. to retrieve your password and log into an old account. But if you've never created an account, do choose the create an account button and go through that process first. Now, as you're going through this, you might wonder, all right, how do I enter income? I'm asked about all of this stuff. We need to know about your income as it is right now. So whether it's income from a job or maybe a couple of jobs, maybe you're working a couple of part-time jobs. So we ask about current income, what you're getting, but then we also ask what you think you're going to make for the entire year. So if you're thinking about, what you should estimate, consider how much you've earned so far, add any unemployment, add any other source of income you think you might be getting this year, and then you can use that to project your annual income. Now, really important is that if any of this changes, you can go back to this application, update your income information. You really want this information to be as correct as possible so that you can get the most benefits that are available to you. So if your situation changes, we really do encourage you to make these updates. In addition to being sure that you're getting the right amount of help paying for your health and dental insurance coverage, it also means that you'll have a lower risk of owing money to the IRS when you file your taxes next year. So if you remember at the beginning, I mentioned advanced premium tax credits. And these are tax credits or savings that are just as they sound. They come in a form of a tax credit, but you're getting them before based on the information that you are providing us in the application. So there's a way, if you want to adjust the amount of the tax credit that you're getting, you do not need to take the full amount that you're eligible for. You can change that. Another really important thing related to income and keeping your application up to date is that you may need to send in supporting documents about your income. We're going to give you a time frame, and that's 90 days. If you need to send any documents, please get that information in within the required time frame to help avoid any issues with staying enrolled in your coverage. So I'm going to talk a little bit more about getting help with this, and I've described some of this, but really there are two kinds of help paying for coverage that you can get through the Health Connector. That help is going to come through the form of advanced premium tax credits, or it's going to be through the Connector Care program, which also uses advanced premium tax credits. So the advanced premium tax credits, what that does is it's going to lower the premium amount you pay each month. The IRS is going to send your tax credit directly to the insurance company, so you just simply pay less each month. You as the individual, and I think I've said some of this, you get to choose. You can apply some or all of the tax credit to your monthly premium payment. So as an example, if you found out that you were eligible for $500 of tax credits each month, and you said, I'm self-employed, I've got a couple of different, projects going on right now, I would rather only use $400 a year throughout the year. You can do that, and it's fun, and you can make that adjustment in the application. And some people do get tax dollars back after they've reconciled their taxes, after they've done their taxes the next year. You might get some tax credits back based on this. Now, the Connector Care program, I mentioned that this is a program that's unique to Massachusetts, and it's a great program, a low-cost program. The way in which we keep the costs down is because we are using federal advanced premium tax credits. So we're taking those tax credits that you're eligible for, plus some state dollars, and those two together, that's what reduces the premium amount that you're responsible for paying each month. So these plans have low monthly premiums, they have low out-of-pocket costs, and there are no deductibles that you would be responsible for if you qualify for the Connector Care program. And depending on which plan type you qualify for, you could choose to enroll in a plan for as low as $0 a month or as low as $134. And again, it's going to depend on the plan type, but also which carrier, which health insurance plan you choose to enroll in. Now, you may be wondering, all right, this sounds interesting. I'd like to take advantage of these programs. And maybe in the past you've applied and you weren't eligible. So there are more savings now available to you. And this is because of the American Rescue Plan and the Inflation Reduction Act. So these were both recently passed. And what these laws have done is they've removed income limits for advanced premium tax credit help. So now people who have income greater than 400% of the federal poverty level do qualify for advanced premium tax credits, because instead of an income limit, it's really a calculation of affordability. So that we take the system, the application takes all of your information and it does this calculation on the back end so that we redisplay plans that are so that you would not be paying more than 8.5% of your income for a plan. So one of those plans would become available for you. So what does that mean? So let's say you are a family of 3 and your income was $65,160 or lower. You may qualify for Connector Care if you, the Connector Care program, if you meet all other requirements. But if you were a family of 3 and you're actually making more than $86,880, I wouldn't discount. We don't want to discount that you still may be eligible for advanced premium tax credits, again, because we've changed the calculation on the back end. So this is great news, and it will be in place for some time. So my colleague Melissa is going to go through a tool with you, and it's called our Get an Estimate tool. You'll be able to see for yourself if you may in fact qualify for these savings. So please do, we really do want people to take advantage of this opportunity. So we know that applying, entering information into the application and finding out what you qualify for are just some of the steps that you need to take before you get into your plan. Once you know what it is you qualify for, you're going to need to shop. So we have a variety of tools on our website where you can enter some of your preferences. So perhaps there's a particular doctor that you want to see. Perhaps there are certain medications that you want to find out and you want to be sure they're covered in this plan. So before applying, you can use this plan comparison tool. And again, Melissa's going to give you a demo of that. And you can also look at pricing from the Get an Estimate tool. But when you're in the application, I think I just want to point out that you still, if let's say you don't do that in advance, but you are going through the application, you can choose and you can use these tools from the shopping process. So you can search for preferred providers, you can search for preferred medications, and all you have to do is click on, yes, I want help. I want help with this process. Now, once you've entered some preferences, you're going to see a set of results appear on this page. You'll see that any preferences that you put in appear on the left-hand side, and essentially you have the ability to, apply filters, see who's, who in fact is your best match. You'll also see the monthly cost of the plan, the carrier's name, the name of the plan, lots of details here. But again, this is all available to you when you shop, when you use these tools outside of your application, and even when you're in the application. You're going to see a bit more level of detail when you're in the application, because the results are really customized to what you qualify for. Now, many people who apply for coverage are required to make a payment. So just very important for me to stress that if you are required to make a payment, it needs to be received by the Health Connector by the 23rd of the month. And that payment is necessary so that your enrollment can be considered complete. When you are in our application, you can click the Make a Payment button, and you can, make your payment that way. Also important to note is payments can only be made by checking or savings account. We do not accept credit card. However, you can also call customer service to pay over the phone if you'd like to pay that way, or you can mail in your payment with your invoice. Now, I know I've covered a lot and you may be thinking, okay, I can do this, I can get myself started, or no, I'd rather just get some help right from the get-go. So I want to point out that there is free enrollment assistance available through our customer service center and across Massachusetts through our community partner organizations. So if you're trying to reach us via customer service, the phone number is 877-623-6765. We have a TTY number if someone is deaf or hard of hearing or speech disabled, and that's 877-623-773. And then our hours of operation are typically 8 to 6 each day. But we do have, there are certain times of the year we have special hours. If there are any changes, etc., you'd want to go to our website. And again, you'll get this link. Provided in the presentation in a follow-up email, so you'll be able to, check out our customer service contact page. Now, on the right-hand side of the screen is listed community partners. So I've mentioned these folks already, but really want to stress that we're talking about trained and certified navigators and certified application counselors. And these folks speak many languages. You can get help from them about your application all the way through enrollment. You can even go back later when you're a member. So they're really great. They can answer questions all the way through the process. However, it is recommended that you call ahead to schedule an appointment for help. And particularly right now, as we're still, kind of coming out of COVID, if you will, I would suggest that you call ahead, and you can even ask, like, if you would prefer to meet in person, you can. If they have virtual appointments, find out. They can help you over the phone. And I think another important thing I wanted to mention is that even if you started the process and then found that you needed, you got stuck, you needed more help, wherever you are, if you call and you give folks permission to access your application, you can, they can basically take over with you. I don't want to say take over, but they can help you and they can pick up wherever you left off. So with that being said, I just wanted to step through some key takeaways and recap for you before Melissa goes through the presentation. So as a reminder, we're here to offer insurance coverage to individuals, families, and small employers in Massachusetts. And people whose income might have been too high in the past could now qualify to be eligible for health plans with savings. This is the link to go to the Get an Estimate tool, but it is also available from our homepage. If somebody needs it, just apply for coverage. You may find that they're eligible for Mass Health, or you have a qualifying event that lets somebody enroll. And a couple of things here. It is really important to remember that if somebody loses employer-sponsored coverage or loses access to help paying for COBRA, has another one of these life events, this is, these are things that give you a special enrollment period. And when those things happen, please do apply for coverage, compare your options within 60 days of losing that coverage. So kind of bringing it back to, where we are today. If you're looking for coverage that begins on March 1st, you should apply, enroll, and pay your first premium by the 23rd of the month, so that your coverage can start on March 1. If you are planning ahead, you can also choose to have your coverage start on the second month after you enroll. I mentioned about applying for coverage online or over the phone with the help of an assister through a community partner organization. But you, as an individual, once you have an online account, you can report your changes and update your online application at any time. And remember, free help is available across Massachusetts. So you can call our customer service or you can go to a community partner, but really would just encourage people to call today and make an appointment if you want some help. Before we go to questions, I wanted to go to my colleague Melissa and see if she is ready to do her demonstrations.
Thank you, Nikki. That was amazing. And yes, I am ready. So what I'm going to do is a couple of demonstrations. So currently I'm on the home page of the Health Connector, and on this page here, you see that we have many resources and helpful tools, but the first one I'm going to show you is Get an Estimate tool. So it's here. If you hover above Get an Estimate, you'll see two selections here. The first one is individuals and families, and the second one is businesses. So we're just going to click on individuals and families. Okay, and so from here, we just have to answer a few questions regarding your household. So the first one, we want to select the coverage year, which is our current year, 2023. And then we want to enter our zip code for Massachusetts. And I'm just going to pick a random zip code here. And then you want to enter what you think your household income will be for the year. So I'm just going to give a random figure here. And then you want to put down number of people in households, including people who may not need coverage. So I'm just going to say that it's a couple, so 2. And then here we want to enter the age of head of household and the second person. So we entered that there. And then we want to take notice here on the right. We have a few selections we can also pick from. This person needs coverage. I'm going to click that. This person is pregnant, or this person is disabled or blind. So we want to choose if this applies to each person. So I'm just going to say that these 2 people here need coverage. And then I'm going to go to my results. So this here is just a reminder that this isn't an application for health coverage, and that's fine. We're just going to get an overview of carriers and how much we will be saving. So here on this page is the estimated eligibility. So based on what you told us, your household may qualify for an advanced premium tax credit to help lower your monthly health insurance premium costs. Your maximum tax credit is $618. You are eligible for silver plans with monthly premium as low as $130.88. And then it further breaks it down for each household member and their potential eligibility. So you see here that both of these couple here, they both are eligible for a Connector Care plan with advanced premium tax credit. So we want to preview plans. And here is just a further breakdown of your estimated savings details. So on the top here, we have the Connector Care plan type. So that's 3A, your tax household FPL, which is 245.77%. And then the monthly APT APTC for a tax household, which is $618. So Nikki had mentioned in our presentation that the advanced premium tax credit is basically a credit that you use towards your monthly premium cost. This is a great way to see your savings. So we see here that the first carrier is Tufts Health Plan Direct. We have the plan name, we have the coverage level, and then we have the monthly premium. And then we see here the APTC savings. So we take the monthly premium cost minus the APT savings, and we get what you would be paying monthly for premiums. So then it goes further. We have two other plans in this couple's area, the WellSense Health Plan and the Mass General Brigham Health Plan. So again, you see here exactly what you would be paying monthly and how much you would be saving monthly. So it's just a great tool to see exactly what plans are in your area and how much you would be saving before you would actually want to start the application process. So it's a great way to just have an overview. So now what I'm going to do, I'm going to go over I'm going to click on Help Center. I'm going to hover above here and then click on Resources. And here we have the Plan Finder tool. Now, this is another great tool to use. And if you keep going down, you see that you can have further information, but I'm just going to click on the Use the Plan Finder tool. So basically what we have here, we can see what providers are in network with the carrier that you would want to choose, which is very important. So we go to individuals and families, and right beside it, we want to continue. So we just answer a few questions here. We want to put in our zip code. And then it says here, do you qualify for connector care? And we can say that we're not sure at this point. And then again, we want to say how many people are in your household, and we can say 2. Again, it's a couple. And then you want to say, what is your household's expected income in 2023? So we enter that information there, and then we continue. So here we want to put down the provider that we usually see. So I'm just going to enter a random name. So we want to see Dr. Patel. And then we continue. And then here we can put whether or not we go to the facility, whether it's Brigham and Women's or what hospital that we go to. I'm going to actually skip that. And then we want to put here the prescription drugs that we use that we also want to make sure that's in network. So I'm just going to put another random prescription drug. And we want to make sure we also select the dosage form and strength that we use. And then we go ahead and compare plans. So here are 27 plans that are available in the area that we put in for the zip code. So it's broken down: plan, drugs, providers, and facilities. So you want to look at this list and you want to see whether or not your drug is in network, your provider is in network, or whether or not we put in a facility that's in network. So here, the first one that we have is the non-standard bronze plan for Harvard Pilgrim Healthcare. And we see here that the prescription is not in plan, but the provider is in plan. And then if we scroll down again, we see the same thing. So based off of that information, we pick whatever carrier we feel is best based on our circumstances, and whether or not you want to continue with your provider, you would pick that plan based off of that information. So this is just a great tool. Again, you want to make sure that your provider, your facilities, and your prescription drugs are in network. That way you're not spending extra for out-of-pocket costs. So I'm going to stop sharing. And now we're going to bring it to our questions. And we have Kayla joining us. And Erin, welcome back.
Thanks so much, Melissa. Thanks for those really helpful demonstrations. And of course, thank you to Nikki for going through all of that content. There is a lot there. So please feel free to continue to ask questions using the Q&A functionality at the bottom. We have received a few that we'll go through, and they might generate more questions. So please continue to feel free to submit those questions. So I guess the first question that we have, as we're kind of looking, we've talked about the Connector Care program, for eligible individuals and families. And we did receive a question regarding kind of carrier participation in certain regions of the state through the Connector Care program, but also more broadly. Why is there a difference between where carriers participate? And I guess the next question would kind of be, what should individuals do if they don't necessarily see a carrier that they might need that cover necessary hospitals or providers?
Sure. Thanks, Erin. Melissa, I can start off with this one if that works.
Yeah, great.
Okay.
Thank you.
So in general, what I would say about sort of what we see across the state with our networks and where carriers are, the way that works is through our seal of approval process. So every year we go through this process where we have certain requirements and carriers come to us and, they agreed to do those things. And, for example, we can say, offer this type of service at $0, or you have to make sure your network looks like, this, you have to make sure there's not certain providers that are a certain distance away. But what we can't do is tell carriers sort of where to operate. So the way the process works is they come to us. And so with Connector Care, the way the program works is that we have carriers come to us and say they want to participate in Connector Care, and not all carriers do that. And so that's why you see, unfortunately, and this is an area that we are very sensitive to and work, I think, very hard to try to improve and address every year. We don't like to see one carrier in one geographic area because we know that's not good for members. So we have done some work to try to change this over the years. I will say one exciting development upcoming for 2024 is that we expect and will be requiring remaining carriers who don't participate in Connector Care to come on board and join the program. Again, that's for the future, so not helpful for this year. So apologies on that, but it is, again, an area that we are continually trying to improve. We're hoping that the Connector Care program, with all the carriers on board in the future, will we won't see these problems, and people won't have these types of network issues. And that network requirements, again, in addition to carrier participation, general network requirements is another way we can sort of solve for that issue, and something that we're always actively looking at. So I'll stop there.
Oh, thank you so much, Kayla. And Melissa, feel free, of course, to add anything into that, but it's certainly somewhere that, as you noted, the Health Connector has been incredibly sensitive to, and we continue to strive to kind of expand those opportunities for our Connector Care members, but also just residents more broadly. So thank you for that. With respect to income, calculating income, counting income can be really challenging. There are so many different circumstances and scenarios that individual households have. Can we just kind of chat very briefly about what should be counted as income? And then I have a few kind of specific scenarios, but when a person is completing their application, do kind of investments count, dividends? How should they consider this income? And I'm also going to put the link to our income page in the chat for folks to take a look at, because I think that has a great breakdown. But just, the best way to approach this, Melissa, I know you work with people day in and day out. Like, what are some of these helpful tips that you can share?
So definitely the link that you just provided basically gives a breakdown of what exactly we're looking for. But what I always try to tell people is that we're looking for the present day income, what they get paid from their employer present day. So basically what you want to do is just put in your income, your employer name, how much you get paid. If there's another supplemental job that you have, you want to mention that on the application. And then you want to basically give the most accurate amount that you get paid per year. That way, when it's tax time, we don't have any issues with taxes if APTCs are provided. So always stick to present day employer income.
And as you think about the dynamics of different households, for households who have maybe young adult children who are considered part of their household, how should their income be calculated if they have part-time employment?
You also want to include that in the application as well. Because everyone considered in the household, you want to include all their information.
Excellent, thank you. And for individuals who, may be retiring early, so prior to the age of 65, and not yet Medicare eligible, should they consider their income any differently? Obviously, if they're on a fixed income, how do they kind of factor in, their income, or how should they best go about counting their income or projecting it?
I can take this one, Melissa, and feel free to add. I think you may have answered this in your last response, just generally about income. I think this would hold true for anyone at any age with any type of income. So I'm just pulling up that link, that very helpful link Erin had shared. So income to include, as Melissa mentioned, we're talking about wages, salaries, tips, net income from any self-employment, Social Security payments, including disability, alimony, any other taxable income. So that could be retirement income, investment income, a whole list in that link. So, and I hope that's helpful. And that link does include sort of what not to include in that in income, which is important as well.
Great. And so Kayla, while I have you, is income, the eligibility based on income, is that based on gross or is that based on net income?
It's net. Yes, and Melissa, please correct me, but yes, it would be your net income.
Right.
And I see that on our list here, again, in that helpful link.
Excellent. Yes, so that is in the chat for everyone, but when we send the presentation around via email, we'll call out some of these helpful links as well so that you can easily find them. So for individuals, it's really challenging to project your income. We have this helpful list of what to include, what not to include, but circumstances change, jobs change, incomes change, household size change. What is the best way for people to approach that uncertainty around income and estimating their income and projecting income? And what happens if they get it wrong?
Okay, so what I like to tell people a lot of times is if there's any changes in income, you want to feel comfortable going back into the application and updating it with the most accurate information that you have. So let's just say you're currently working and for whatever reason, maybe you changed jobs or you got a raise or something has changed. You can feel free to log into your account and make those changes by reporting a change. Or you can also send us information. I believe that we have now a template that you can use that you can basically put in if it's unsteady income that you receive, it's a better way for us to help you get an estimated amount, or we can help you figure that out. We do have assisters that can help you, or you can again go online and go into the application and make updates on your own as well.
Great. So report the income you have, fixed or not fixed. If you're having supplemental or side jobs, report that income as well. And just do your best to come into your application to update your information as it changes, as circumstances change. And again, you mentioned the help that we have through the contact center and through our navigator organizations or certified application counselors. Before I move on, Kayla, did you want to add anything to that? I know income is so tough.
No, that's great. It is a tough one, but I think that was really helpful.
Great. And so what happens? So we've talked about this Great Connector Care program and opportunity for federal tax credits to help. What if your income exceeds those limitations? Is the Health Connector still somewhere that we would encourage people to come and shop?
Yes, definitely. I think, there are lots of benefits, even if you have an income that brings you over that limit for subsidies. And what I will say is, we have our Connector Care program, that's state and federal subsidies. Then we have a whole range of incomes that might qualify for federal subsidies only, but that range is a lot higher now with some federal changes. So even if you have a higher income and you think maybe in the past you weren't eligible for that help, you might be. But again, even if it is higher than that, come on in. There are lots of reasons why you would benefit from shopping through us. You can compare plans easier. As Nikki mentioned earlier, every plan through us is safe, comprehensive, meets the right standards. So lots of benefits, even if you don't qualify for those subsidies.
And I would just really stress the fact that the plans sold through the Health Connector, those are commercial plans, they meet the state standards. Individuals, won't go to use their health insurance coverage and find that, kind of the services that you would just generally expect to be covered aren't covered. So we have comprehensive health plans that provide that peace of mind and security. And when you say compare plans, essentially what that means for individuals is you can look at the carriers that are available in your region and make a decision based on, your network needs, your provider needs, prescription drugs, or your price sensitivity. And you can kind of compare them side by side, as Melissa showed us. And so you can make that informed decision with them all before you in this kind of marketplace. So thank you. As we talk about, this is a nice segue to our next question, as we talk about making those decisions based on, hospital needs or doctor needs, sometimes we have those great tools, but there are times when maybe they're not 100% accurate, or they are updated regularly, but may not have all of the most recent information. Can you guys speak to what the best approach is after using those tools?
Sure, yeah, I can. Want me to start off, Melissa? And I would welcome any thoughts you have. I would say, the tool should definitely work. So I think, it's an issue for us if it doesn't. If there is a problem and we're not getting the right information from providers, I think if somebody made a choice about a plan based on information that wasn't right in the system because a provider didn't update that information, they should always reach out for help, because we don't want you stuck in a plan that, you made that choice based on information that wasn't correct. I hope that's not common and that's not something that happens all the time. But again, as it sounds like this may have happened to somebody. So I would just say that always reach out. We would definitely work with you. And I would say we try our best to make sure that information is up to date, but we do rely on the provider offices. I think an extra step, that could be helpful is when you're shopping for a plan, call up your provider that you really want in your network. Just make sure that they take the plan you're about to enroll in. And I think the best bet is always to directly call the provider's office. But again, we would hope that our tools are up to date. And yeah, I don't know if Melissa, there's anything you'd add to that.
Sure, yes. When you're going through the application, everything's saved. So if you have to go back, that's okay. If you have to make a call to your provider just to make sure that they're in network, it's okay. You can always go back and then select whichever plan is best for you and your family. So yeah.
Sorry, my mute button was hidden. Great, thank you so much. And that's right, they are updated throughout the year on a regular basis, but our information does come from the providers. So just take that extra step, as both Kayla and Melissa noted. So when we talk about affordability, but on the employer side, how is it deemed? You're completing an application, then it asks if you have access to affordable employer sponsored health insurance. How is that determined? How should someone complete this question?
Yeah, that's a great question. So affordability of an employer plan is defined by federal law. And so that means a very specific thing. It has to be a certain percent of your income. It has to be a certain minimum value. And that, again, that is a federal definition. And so we do have a worksheet on our website that can help you tell if that applies to you. I can resend it in the chat now, but I know it's been in some links that have floated around already, but I'll just make a note that that has that information in it. When you go into the application, there will be questions about that. And so that will be calculated. And so you will know if it's affordable and meets minimum standards. But yeah, you know, just be affordable doesn't mean it feels affordable. That's, again, just a federal definition. So I would just note that as well. And Melissa, if there's anything you'd like to add, please feel free.
Perfect. Thank you.
Okay.
And we have time just for one more question. So if somebody was previously had health insurance coverage through the Health Connector, and then they gained health insurance through a different source, whether it was a partner or a spouse or their own employer, but now they need insurance again, do they create a new login or what should they do?
So I'll take this one. Please do not create a new login. Use the login that you had before, because we want to avoid making a duplicate account, which can confuse things. So if there's any questions trying to access your account, please give us a call and we can walk you through those steps. Great.
Thank you so much, Melissa. Well, thank you so much to everyone for joining. Kayla, did you want to add something? Sorry.
You know, I did want to go back just briefly about the question about connector care and network. I just wanted to say that I think if that individual does want to reach out for assistance and talk with us more offline, I think we'd be happy to help and get you to the right place. I wanted to note, if there is a medical reason that a provider is the only one a person needs or can see, and that's their only option, there are, that's a different conversation, and there are things we can look into to help. So I just wanted to encourage anyone with that question to reach out. That's all.
No, great, thank you. And on that note, I will include the contact information again for our customer service center. And then also the link that is included here is also to our navigator page. So from there, you can find a navigator that might be closest to you, give them a call, see if they can help you, but also our customer service center can assist with these things. Because as Kayla noted, there are other pathways to access a certain provider if they're not just generally covered within your plan. But thank you so much again to everyone for joining us today, for taking time out of your day to learn about the health insurance coverage options that are available in the Commonwealth, the financial resources that are available to so many to help make it just a bit more affordable. We know it's complex, so we appreciate you taking the time to learn about it and learn about the resources that are there in your communities to support you. And thank you so much to Melissa, Kayla, and Nikki for providing such helpful information and answering these questions. We will be distributing the presentation in the coming days, as we noted, with some helpful links as well. So please feel free to use those as a resource, and of course to contact our call center or find a navigator. But thank you again for taking the time to join.
Thanks, everyone.
Thank you.
Be well.